Tomorrow is the last day for California's universal mask mandate, but parents, students, and teachers will all have to wear masks at school campuses for a little longer.
Yeah, today the Health Secretary of the state, Dr. Mark Galley, saying new guidance may be coming on that in 2 weeks. And in a press conference today, Dr. Galley added that the state has 12% of the students in the entire country, but less than 1% of school closures. And he says that that has been largely due to the mask policies that are in place right now. But now with infection rates trending downward like we've seen, he says that they are reassessing that need. But already, as you might imagine, there are growing calls to end those COVID restrictions.
And California Congressman Bera says this is the time to call for an end to the COVID-19 pandemic. He joins us live tonight to explain what he means by this. Welcome, Congressman. And we should also mention, you're saying this as a doctor and the former chief medical officer for Sacramento County, so really blending the medical with the political. So let's start out with the latest numbers, because people may be focused on the fact that there are still more than 8,000 people in the hospital with COVID. We have 1,700 people in the ICU right now. 600 people have died so far. So why is this the time to declare an end to the pandemic?
Well, thanks for having me on. And I do think about this as a physician who has a public health background. What I mean when I say ending the pandemic is we have to learn how to live with COVID. At this juncture, the days where we thought maybe we could eliminate COVID, COVID-19 is going to continue to circulate. We likely will see new variants, perhaps on an annual basis, and even some variants that may elude the vaccines that we have. But right now is kind of that transition. We know we've got effective tools. The best thing we could do is still boost our vaccination rates, continue to encourage folks to get booster shots. That is the best way to protect ourselves. But we've got to start, learning how to live with COVID-19.
So is it a matter of just going back to some semblance of pre-pandemic life, or is it something like where it's endemic, where you're just living with something yearly like the flu?
Yeah, so it's more endemic. We've learned how to mitigate transmission of disease. So if we have flare-ups, we can use our masks. We have readily available at-home rapid tests. So if you're going to go visit a vulnerable parent or a family member, you can take a rapid test and make sure that you're not an asymptomatic carrier. We also learned how to telework, telecommute. So if you are ill, you can stay home, but not totally have to isolate yourself, but you can stay connected. And then we have to start investing in the research to come up with better therapies to manage COVID-19. We've got some antivirals that look very promising. And, as we've known with other viruses, sometimes you need multiple antivirals at the same time to knock out the disease.
Yeah, so an interesting roadmap there, kind of laying out how we can live with this. You did mention variants. We've been through Delta right now, kind of at the tail end of Omicron. What happens if there is another dangerous variant? The fear this whole time has been, having our healthcare system swamped.
The best way for us to avoid those variants is to really continue to get vaccination rates up. But, if we have better biosurveillance, we can do wastewater surveillance. We've invested in gene sequencing. So the sooner we identify those variants, hopefully we can either come up with new vaccines that can quickly stamp out those variants. Sometimes we might have to pump the gas pedal and dial things back a little bit. But again, that's all learning how to live with COVID as opposed to, really shutting the country down again. I don't know that our national psyche can continue to take that any longer.
Yeah, we've obviously covered many stories about people who have just about had it, but let me just tick off the recommendations. I mean, they're continuing to wear masks, isolating when symptomatic. California still has that mask requirements for schools. So, I mean, do you feel like the CDC has it wrong, the White House has it wrong, the State Health Department, do they have it wrong, or what's your opinion?
I think the CDC and the White House has been a bit more cautious. There were obviously stumbles at the beginning of the pandemic. So I think they are going a little bit slower. You're hearing a lot of folks in the medical profession saying now is that time to move forward. And you touched on schools. Our kids have had, a horrible time these last 2 years and real setbacks, as well as parents. We know how to keep kids safe in school. We've, as Congress, have allocated billions of dollars to school districts to upgrade the ventilation systems, to put HEPA filters in. They really ought to do that because that'll actually keep our kids, our teachers, staff safe in the schools. It'll also reduce influenza rates. It'll, improve asthma. So there's things that we know how to do, and we ought to be doing this.
So, as you were just saying, you are a little out of step with some of our current administration's members of your own party. What reaction have you seen so far? Are you getting pushback?
You know, I actually, today with the op-ed that was published, we've got a lot of positive reaction towards it. Because again, for those of us that are vaccinated and boosted, right now, the current variant poses very little risk. You may catch it, and I think a lot of us know folks that have tested positive, but they've had very mild symptoms. Again, I think for those that are unvaccinated, for one reason or another, I would continue to encourage them to wear N95 masks and high-quality masks. I'd encourage them to continue to be cautious. But, you know, for the vast majority of folks that are vaccinated, you know, I think we can start getting out there and living our lives.
Congressman Ami Bera, thanks for talking with us about this. We'll keep in touch. Thanks.
Thank you. You all.
Another